supporting kids having mental health problems turns everyday life activities into mental health crises for young kids. Take a look at this from the Health Resources and Services Administration. In a 4-year span, children between 3 and 17 say their anxiety went up roughly 30%. 60% of them are now medicated. At that same time, and for that same age bracket, there's a 27% increase in depression. 80% of them are medicated. All that medication costs a lot of money. For all of 2021, nearly 1 in 10 of all kids were taking routine medication. New York Times just published a piece. This is not the way to help depressed teenagers. Quote, teenagers who are still developing their identities are especially prone to take psychological labels to heart. Instead of, I'm nervous about X, a teenager might say, I can't do X because I have anxiety. Reaffirming that research shows undermines resilience by encouraging young people to view everyday challenges as insurmountable. Joining us now, Bethany Marshall, psychoanalyst, marriage and family therapist. It's good to see you. Thank you very much. Take me through what you make of this study.
Well, actually, I'm Dr. Daniel Bober.
Yeah, I'm realizing when I saw you that I think the teleprompter was wrong. Daniel Bober, correct, sir?
Yes, Dr. Daniel Bober.
All right, there we go. Forgive us. What do you make of the study?
Well, I do agree that I think we do rely heavily on medication, and if you look at the way we treat mental illness, for example, in other countries, they focus on more things like resilience, forming healthy attachments, gratitude. And so I do think that medication, I always say skills before pills. So I think that's really the way we should be looking at as medication as a last resort rather than the first thing we reach towards.
You think about all the sort of discussion on Instagram and TikTok, all the ads, all the sort of embracing of kids and embracing that you're brave enough to come out. And look, there's kids who have real issues, and we don't want to minimize that. But is there kids on the bubble who, by always talking about mental illness and suddenly having a mental illness gets you medication and gets you out of tests and gets you to have more time to do this and it explains away your behavior, is that enabling and creating kids who it's a lot easier to say, I don't want to take the test or I can't take the test rather than dealing with your own fears of taking the test?
Well, I agree. I mean, I think this is in many ways a uniquely American phenomenon. We're always reaching for drugs, whether we need drugs to concentrate, to be better sexually, to lose weight. We're always looking for a quick fix, and we're not really doing the work. And I think we need to be teaching our kids to actually do the work, to work on themselves, to develop problem solving and coping skills. That's what we should be focusing on for the next generation.
Why aren't we?
Well, I think that in this country, we are largely driven by corporations, and there are some in the pharmaceutical industry that feel that if you create the disease, the drug will follow. So we teach people that there's always a pill and you can do it quicker, and I think the pharmaceutical companies and the insurance industry would rather give someone a medication than actually have a child, for example, sit there with a therapist and do the work and use skills which are much more enduring than pills.
Practicing psychiatrist for 15 years, board certified psychiatry, child and adolescent psychiatry, diplomat, American Board of Addiction Medicine. Are we addicting kids to pills, though? I think about ADHD medication specifically and some of the other stuff that, yeah, it may make you feel better, but then it is a lifetime of taking it, is it not?
Well, I would say dependence more than addiction. If I prescribe you a blood pressure medication, you are dependent on it. I need to wean you off. Addiction is compulsive use despite negative consequences. So in a way, I do think we've made people dependent on pills, and they find the easy way out than rather doing the work on themselves, which I think is true not just in kids, but in adults I see every day. You know, people would rather take a pill than do the work.
Yeah, I think about some of the research now showing that high intensity exercise is as effective as some low dose antidepressants for folks.
That's right. Exercise is one of the best antidepressants there is. Absolutely.
Yeah. Yeah, no, I appreciate it. Yeah, hey, look, you're great to come on and talk about this and be able to call things as they are, because I know it's popular in your industry especially to not do that. We appreciate the honesty, Doctor. It's good to see you, sir. Thank you. Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.